Hey, y'all, welcome to the latest and greatest episode of the Black People Parenting Podcast. Of course, it is I, Dion the Glad Dad. I am here with Dr. Bambi Gaddis from HVTN, the Structural Health Dynamics LLC, and Fred Hutch. And once a month we have these conversations surrounding health, wellness, particularly about HIV and AIDS. And we are here today with Miss Tamara Bynum Dozier. And Tam is going to talk to us about HIV and AIDS pertaining to Black women from a case manager standpoint. Tam is a case manager for Minority Aid Support Services out of Hampton Roads, Virginia. So she is going to speak to some of the things that she is seeing. If you remember last month, we had her counterpart, Keisha. Keisha is the communications director for that same organization. And we are going to talk about HIV and AIDS and how it is impacting Black women from a caseworker's standpoint, because Tam is the one who is doing the good work out here of making sure that folks have services and making sure that they get the things that they need. So I thought it would be a good idea to have her on the show. So Tam, welcome, ma'am.
Thank you. Thank you for having me, guys.
For sure, Dr. G. And also, before we get started, can we just say happy belated birthday to Dr. Gaddis? She is she just recently celebrated her, I don't know if she wants me to say,
Don't care.
But you don't care? You don't care? Okay, so she is now celebrating her 69th birthday recently and her 30th wedding anniversary. And so just huge congratulations to Dr. G. And she's also going to Fashion Week when she leaves us. So she got a lot going on. So
I appreciate it. Can I throw something in here, by the way? Because I want to really lift up again Fred Hutch and the work that Mr. Chavis, the founder of Glad Dad, and I have been doing along with other faith ambassadors or faith consultants since last year. Many of you remember COVID. And as you know, COVID is still alive and well. But during the time back in the early 20s, I believe it started before 2020. We just didn't know what it was called. Right. And it wasn't until 2020 that it began to take a name. And so then we were CoVPN. We were the COVID trial network. And what we were focusing on at that time was trying to educate clergy, lay leaders, and community about what this thing was called COVID. And as we began to find solutions to the epidemic, meaning we were coming up with a vaccine, we had to then explain to community. So, and as you all know, they already thought we had cooked up something, that it came out of nowhere. That it didn't come out of nowhere. We've been talking about COVID for some time, but we didn't have the resources. We didn't have the pandemic, the number of people that were dying literally from this infection. And so long story short, we were called as faith ambassadors to help interpret the science, to make sure that the community understood what was going on in the backdrop and try our best to try to redirect misinformation and lies that were preventing people from making a concrete and informed decision about getting vaccinated. Well, guess what happened? During the time that we were so busy and needing to address COVID, we took a lot of resources out of HIV. And in removing those resources, a lot of the work that was going on in HIV prevention, coming up with a vaccine, people were saying, well, how did you come up with a COVID vaccine so fast, but you have yet to come up with an HIV vaccine? And the reasons are multiple in scope, but at the end of the day, HIV is different than COVID. And the way it responds in the body is different. And so our challenges have remained, but we're making progress. And so I just want to lift up the fact that the Fred Hutch Research Center, in this case, UB The Cure, who is my oversight, and HVTN, HIV Clinical Trials Network, our new mission is standing in spaces like we are going to tonight, which is to talk to folks who are on the front lines, those who are still working in the pandemic or the epidemic of HIV. And like COVID, it hasn't gone anywhere. And there are people that get up every single day trying to not only prevent it, but try to help people navigate what happens when you do test positive.
Okay.
And so I am grateful for this opportunity tonight. And remind me before we leave, for those who are Tubi addicts, I watched a movie today called Welcome to My World. If you'll jot that down. That's a whole discussion in itself, how it's presented, how HIV is discussed. And I'd be very interested to see how it compares since it was made in 2019 and we're in 2024. So I put that as a backdrop. Welcome to our world.
I didn't have a Tubi recommendation on my bingo card for tonight, but here we are, Dr. G. Here we are. Tam, let's start with the interview portion of this show, ma'am, because me and Dr. G will be here all night. So let's talk about you and your role and what you do and the great work that you're doing. Let's, if you could, start by explaining what HIV case management is and why it's so important, specifically for Black women.
Gotcha. So HIV case management is very important for Black women, anyone. But it starts with making sure that we take care of the client or the person as a whole. So making sure we link them to care as soon as we know that they have that positive diagnosis. Making sure that we guide them in this next journey of their life, and making sure that they have the resources or know where to go for the resources if we are not able to provide them. So
Got
pretty
it.
much just, starting from scratch, making sure that we lead them where they need to be to live a healthy life with this new diagnosis.
And we oftentimes hear and have the conversation, we've had it here a couple of times, about the disparities in healthcare for Black women. Can we talk about what the statistics say in regards to HIV rates among Black women and, the care that they're receiving?
Gotcha. So as of 2023, CDC reports that Black women were disproportionately affected with HIV in the United States. This was in 2020. And they accounted for at least 60% of the new HIV diagnosis at the time. And that is
60%. Wow.
60%, despite representing only about 13% of the female population.
Right.
So
Wow.
Now
that
you're
just,
in North Carolina, correct?
no, I'm in
She's in Virginia.
You're in
Virginia.
Virginia. Okay,
Yes,
so
ma'am.
so how do your rates in Virginia for Black women compare to the United States as a whole? Is it the same 60% or is it higher? Because I know in South Carolina, the percentage of Black women diagnosed and living with HIV is significantly or is higher than the national average.
Gotcha. I believe that it is right now. I don't have that information with me because with my experience as a case manager, majority of my clients are men. I don't have that many female clients. So I would say, to speak to my experience, it's definitely less. But that's not to say that um, that number is not the same as where you're the region you're talking about.
What's the age range of the men that you typically have in your caseload?
I have between early 20s up to 70s.
Hmm.
So it we have all walks of life. We have
Mm-hmm.
early out of teens, 20-year-olds experiencing life for the first time. And then we have individuals who have been living with it for years and years.
Hmm. Have you noticed, because of course the stigma around men is that we don't always take care of our health, and we don't
Hmm.
always do the things that we are supposed to do to remain healthy and stay healthy. Have you noticed that men are a little bit more reluctant to get treatment or to get a diagnosis or to get services when it comes to HIV and AIDS?
Yeah, I mean that that stigma remains prevalent, um, no matter who it is, especially with that diagnosis. But I do see that a lot of our male clients, um, they may get it and take a while to get into care because they just don't want to face the fact that that is their new reality. But then you have some that will, do what they need to do once they accept the fact that this is, something that they have to deal with in order
Hmm.
to move forward in life and stay healthy. But yes, this is definitely a situation where some men just they're reluctant to get um to take care of themselves or want to follow through with everything just because it makes what's happening true.
Hmm. Hmm. Is there a is there a difference in the approach, and I'm talking men and women, is there a difference in the approach from your experience based on like generation? So does a 20-year-old look at it, let's say they get the diagnosis at 20, would
Mhm.
that person, do you think, look at it differently than, let's say, a 45 or 50-year-old?
I would believe so because I think in my experience the younger generation have seen or know of individuals who may be living with HIV already, and know that there's medication that will help them live a healthy life versus you get a diagnosis 20, 30 years ago, the fight was still going on trying
Hmm.
to excuse me, I'm having a brain fart. The fight was still going on trying to provide medication or any kind of support that will help people sustain.
Yeah. Dr. G?
Um, I keep thinking about those, most of the statistics nationally and um, statewide continue to tell us that there's these different stepping stones, after
Mm-hmm.
diagnosis, after someone has been told
Mm-hmm.
that they are HIV positive. Uh, let me ask my first question. So, in your organization, um, once they're given the diagnosis,
Mm-hmm.
what typically happens? Because I know that, and I'll discuss our triage process in our organization later. But I'm very interested in that because that's where I think we lose a lot of people.
Mm-hmm.
Those
So
that that never come back,
yes, ma'am.
or what we do with them from the moment we say
Mm-hmm.
you're now a person living with HIV, and what
Mm-hmm.
do we do with them in that moment while we have our
Mm-hmm.
hands on them. So,
Right,
what
holding their
do you all
hands.
do in your organization to try to? What steps do you take to increase the likelihood that they will come back for the next sequence of follow up?
Right. So once they're given that diagnosis, we one process it with them. We go through the whole process with them of them taking that information in. And then once they're able to receive, the next steps, we go ahead and get them set up with an infectious disease doctor. We get an appointment set up. And then once they have an appointment set up, they are able to get labs drawn, additional labs drawn. And then once they get their labs drawn, they're able to get a doctor's appointment to actually see the doctor to go over those labs and to talk about and discuss what medication option is going to be best for them. Once they start their medication, we make sure that they follow these different markers and make sure that they know when they need to go to the doctor and when they need to get labs again, and watch their viral load once they have their lab results. And that requires them to take their medication daily, so that they are able to remain undetectable once they start taking their medication. But we
Oh, I'm sorry. You go ahead.
No, I was going to say we just hold their hand and walk them through those processes and make sure that we are reminding them of the things that they need to do, and then help them do those things if they're, not able to remember that or don't know what to do, or because they're, so distraught by the diagnosis and the stigma of it. We're just helping them along the way until they're comfortable enough and independent enough to take it on their own.
So you said something.
No, you go ahead. Go ahead, Deanne. I'll come back.
Yeah, because I want you might can chime in on this too, Dr. G. But Tam, you said something that made me think in a way that I've never really thought about before. You said the medicine they're giving now could help them remain undetectable. Is that what you said?
Yeah, as long as they are taking it as prescribed by the physician.
Right. Okay. Mm-hmm. So my question is all of the medicine that is prescribed now, and I may not be asking this in the correct way, is the medicine that's prescribed now, does all of it have the ability to make someone undetectable? Does that make sense?
Yes.
So if a new patient comes in right now, that new patient can get something to make them undetectable. Is that fair? Correct?
As long as they are taking it as prescribed, they will reach that level. Yes.
They have the potential
to reach that level. It doesn't happen instantly, but they have the potential to reach that level.
So
Right. I'm sorry, Dr. G.
No, you go ahead. I was
going to say they may have underlying factors that prevent them from reaching that level with other health issues. So tweaking what medication combination that they're taking may be something that they have to look at, especially if that one particular med that was prescribed early on is not helping them reach that level.
Okay, so does undetectable mean you can't transmit it?
Less likely.
Yes. Less likely to transmit.
When you hear the term U equals U.
Right, correct.
Mm-hmm. Undetectable equals untransmittable.
Yes.
That is the scientific backdrop to why we encourage people to take their meds.
Correct.
The goal is undetectability.
Yes, ma'am.
Like one step. So I want to jump back because I think we need to bear in mind that we're talking about to lay people, for those who are listening on here, who are like, we're hearing all these terms like undetectable and U equals U.
Make it plain, Dr. G. Make it plain.
So what I want to say is, the whole goal is to reduce the length of time between diagnosis and their entry into care.
Correct.
The longer it takes them to get into care, the more likely they are to get lost in the system, because fear and stigma will take over. So one of the things that we did to reduce that is all of our staff who did the testing were phlebotomists.
Yes.
So they drew blood at the moment, not because they already knew the person was positive because they were doing a rapid test.
Correct.
They were drawing the blood for the purpose of getting what Ms. Dozier described as a CD4 count viral load, because that's what would tell us the count of that within the blood of the CD4, which is what the HIV creates, right?
Yes, ma'am.
We're looking in the blood to see how much is it being produced.
Mm-hmm.
So the formula is the higher the higher the viral count, the
Mhm.
greater the risk for moving into AIDS.
Correct. Yes, ma'am.
That makes sense, Dion?
Yes.
The
Yes.
lower the viral load, the less likely they are to transmit.
Correct.
People take the medicine. Their sole purpose is to take medicine to reduce their viral load to achieve undetectability.
Virus suppression. Correct. Mhm.
And that's what
So
we call viral suppression.
Mhm.
so it's safe to say, and I believe it was on this show with Dr. G that someone said this, or I might have heard it somewhere else, but I don't think it clicked for me until just this moment. So it is safe to say that if, hypothetically speaking, every person today who is living with HIV and or AIDS were to get the medicines that they need and they were to take those medicines in accordance to what their doctor told them, we could alleviate the epidemic.
We could.
We
That is
could
that is a fair assessment.
legitimately, it's just like pregnancy.
Mhm.
How many women have been on a birth control method? They were on an IUD, they were taking the pill, they were doing something to reduce their risk of pregnancy, but yet,
They still got pregnant.
so we never talk in absolutes. We
Right.
don't
Right. Gotcha.
talk in probabilities. But what
Gotcha.
you're saying is absolutely correct. What Ms. Dozier is talking about is absolutely on point, which is that it's like diabetes or any health disparity. If you take your medicine as prescribed,
Mhm.
and try to be as compliant and adhere to what the doctor says as much as possible, you too could reach viral suppression.
Mhm.
You too could. So, and why is that important? It's important because what about we make these assumptions about people living with HIV that they don't have sex anymore,
Correct.
they don't love anymore,
Mhm.
they don't have babies anymore. That's
Right.
simply not true.
Correct. They're still
But
living full lives.
a virally suppressed person is definitely a candidate
They outside.
Mhm.
to be able to be part of creating children,
Mhm.
especially if their partner who's negative is on PrEP
Absolutely.
or pre-exposure prophylaxis. So how does that play out in your work, Ms. Dozier, with let's say you have a client who's living with HIV, right?
Okay.
They have a partner who's HIV negative.
Mhm.
How does your organization handle that?
So we try to encourage anyone that has a partner that is negative, and we know that they are still engaging in sexual activity to get on to the PrEP program or be a part of PrEP so that they are protecting themselves as well. So anyone that comes in that tests positive, we have that conversation with them regarding their partner. And then if their partner is open to coming in, we get them signed up with PrEP.
What if they have more than one partner?
We encourage we encourage them to have whoever that they are sleeping with take the precautions that they need so that they are keeping themselves safe while still engaging in their preferred activity. So yes.
Very politically correct way to state that. Cameron, good job.
What's the unpolitical way to say that?
I don't know. This is in my field of expertise, but I know that was a very
I think that's
clean and
fine conversation, especially since we're talking about Black women.
Say it again,
mhm.
Dr. G.
Say that again.
And I was asking you to repeat what you said again.
I said they're Black women, outside of being what I perceive to be the most unappreciated species on the planet,
Mhm.
are also subject to a lot of things that don't apply to men and don't apply to other races.
Okay.
And one of the areas that I think we have been stigmatized around is sexuality.
Mm-hmm.
How many partners we have, what types of sex do we prefer or engage in, and what kind of judgments are made about Black women around their sexual lives, that really set us up for failure, that really set us up for being a statistic, because sometimes we're so busy lying and perpetrating and trying to project someone that we're really not, that sometimes we miss taking the kinds of precautions we should take because we don't want other people to think certain things about us.
Okay.
And when we look at the ratio of men, Black, I was sitting out talking to a brother and his woman the other night. And I said, you will accept the fact that the ratio of Black women to men is like 15, 20 to 1. For every Black man, there's about 10 to 15 women, Black alone, that he could select from.
Mm-hmm.
So somebody is sharing.
Correct.
And that's the conversation we don't want to have with women, and certainly with Black women, that if we go into sexual intimate spaces and we presume we're sharing, what do we do with that? If we acknowledge that we could be sharing,
Mm-hmm.
what do we do with that information? And so as a parent, Mr. Chavis, of a daughter who's in college, how would you maneuver the conversation?
Lucky me. Well, I am someone who, I have tried and done everything that I can to tell my daughter the game as best as it could be told, right? I give it to her from my perspective, from a man's point of view, someone who was outside, someone who has had his fair share of interactions with the opposite sex. And
Okay.
I basically try to tell her that, number one, instill in her the value that she has in this world. Like, she is the prize. She is the reward. If anybody, male or female, romantic friendship comes into her life, she is the cream of the crop. And I want to be sure that she knows that and understands that there is nothing that should be accepted from a man that she doesn't want to accept. So if she doesn't want to accept a man that she has to share with another woman, then she should not feel the need to do that, because I've tried my best to instill in her a certain level of value and a certain level of confidence and a certain level of self-respect, so she knows how to carry and conduct herself. Now, what she decides to do when she gets outside, that's on her. I can't control that. I can just
what if she
give her a game.
What if she told you she didn't mind sharing?
Even with all the information that
With
you
all the
shared with her.
information and all the conversation, she said, look, it is what it is. I have to make choices.
Yeah.
I don't mind sharing. I just assume I'm sharing. Then what?
Then I would continue to reinforce what I've told her. But she a grown woman at this point. Like, my daughter 20. All I can do is guide you. I can lead you to the water, but I can't make you drink it. That's it. And I think, raising young adults, they're going to bump their heads. There are going to be some mistakes. I think when and I don't want to give too much of her business out there, but she's had friends that she's talked to, and I asked them, what they were or what the situation was, and she, say, "Oh, we just going with the flow." And I had to get a definition of exactly what going with the flow means, because I know I didn't told a young lady, let's go with the flow a couple of times. So whoever this young man was that put this in her head, I done been there. So I had to tell her like this. Let me tell you what going with the flow means and what it entails. If you cool with just going with the flow, then hey,
you get strung along until
that's it. Either you getting strong or you doing the stringing, one or the other. But
right.
What you're not gonna do is say your daddy didn't tell you, because I'm gonna give it all to you. I'm gonna give you the condoms to use. I'm gonna make sure you got your birth control pills, your prescriptions refilled. I'm gonna give you all that, because you're not gonna get out here and be like, well, you never told me, or you never. No. You ain't gonna do that. I gave you the game. What you decide to do with it is your choice.
Well, she's definitely a blessed one, because there are some that don't have that at all from anyone. So,
yeah,
being able
and
to.
Dr. G, go ahead, Tam. I'm sorry.
No, I was just saying, being able to do that for her as she grow up and experience life for herself. She has that information to fall back on, and hopefully she is able to take it in and help her make those decisions that will make or break, in life.
Yeah. And Dr. G, as a daughter of a parent who was a father, how it can be. But you are also someone who has experienced life for almost 7 decades now. So I want you to talk to and speak to how this the women's sexual revolution, so to speak, has changed over the years, because now we're seeing where pop culture wise, women are talking about like their situation now. There's a situation now with Cardi B and her husband slash person that she separated from. She basically went on Instagram last night and told him that she had sex with somebody else while she was pregnant with his baby. Right. So we are starting to see more I'll call it openness, or I'm not going to listen. I don't have a hell or heaven to send nobody to, so I'm not going to judge. But that's something that wouldn't have been done in the 80s, right? You wouldn't have seen Felicia Rashad talking to Ahmad Rashad crazy on social media. That's not going to happen. But things have changed now, and we're in a different landscape. So I want to know to you, Dr. G, what does that look like as someone who is a GG, someone who is raising great grandchildren? How does that look to you when we talk about the stigma when it comes to women and sexuality?
Well, social media, I know you hear that so much, but we didn't come up having that kind of access where we could, in a moment, get in front of a telephone, a cell phone, and transcribe our reality to the world in the course of seconds. And so Felicia Rashad did not have that kind of opportunity, nor did I at my teens. And so you cannot talk about easy access or easier access to stimulating and scintillating information without talking about social media, because if it were not for social media, you would never have seen Cardi B on Instagram or whatever she was on sharing. So that's my first. Secondly, there's no description of lack of intellect. And then we get into this conversation about education. The average person, and I'm certain that Ms. Dozier knows what I'm referring to. When you get into intimate conversations with our clients and we realize the magnitude of ignorance, and I say this with no disrespect, but there's a reason why our children are illiterate when it comes to sexual health. And if you look at the world and what is happening even more pervasively, is that we are doing everything as a country to live a double standard, which is one, censor all concrete science-based information from our children about their reproductive health, their sexual health, while we simultaneously flood the channelways with pornography, with social media and movie platforms that allow them to see absolutely any possible thing that would help stimulate their sexual urge. So we're a walking hypocrisy in this country unlike many other nations. And then we wonder, and then we have the audacity to judge how a person would walk into my office, walk into Ms. Dozier's office, and assume that they have all of this information that they should have known.
Mm-hmm.
And my question is always to parents, to clergy, to whoever. And where, pray tell, did they get this information that you continue to say they should have?
Mm-hmm.
Did they get it from you? In your case, you are crystal clear of what you're attempting to do. Ask your average parent, do you have a book or any kind of science-based book about sexual health in your house? I know you have a Bible, but do you have a sexual health, human growth and development book so you can refer your children to it? When they come in from school and they're talking about things that went on, how do you address it? Do you immediately start judging and bashing and condemning, or do you say, tell me more? So that you can understand what is it they're hearing, and then use it as a teachable moment to share our values, as you've well said, Dion, about how you take these moments and then share with your daughter, but yet hold her accountable in the same context.
Mm-hmm.
So my short version is stop lying. We adults have to ask ourselves 6 questions, and based on the answers to those questions, that should lay a platform for what we do in our church, what we do in our homes, what we do in our schools. Number 1, the first time you had sex of your own free will, where it wasn't coerced, it wasn't forced, it wasn't a sexual assault. When you said, I'm big enough, bad enough, and I'm old enough, and I'm doing it. How old were you? Number 2, who were you with? Number 3, where were you the first time you did it of your own free will? Did you use any form of protection? If you did, what was it? Was it a condom? Were you on birth control? What was it? Secondly, were you married or single? And engaged, we was fitting to get married, does not count. You were either married or you were single. And finally, what could anybody have said to you? Was that person in that place and at that moment that would make you just say no? This is what I know from thousands and thousands. And remember, you said I'm almost 10. So that being said, 45 years I've asked these questions to the faith leaders and the like. And this is what I can tell you. Most of us.
10, Abraham Lincoln. I don't even know what that means. 7 years ago.
We're teenagers the first time we did it. Based on the age of the person I asked. If they're older, cars, barns, bushes. Nowadays, it's hotels, motels, common answer, the male's house. So we're so busy looking at the girls, we letting our boys run amok.
Mm-hmm.
Number 3, they were not married. They used no form of protection, and if they did, they used a condom, which we don't want to talk about anymore.
Mm-hmm.
And most importantly, they honest enough in writing, because these are questions I asked them to write the answer. They say nothing was going to stop me. Or they'll say something like, well, had I known they had HIV, or had I known they had an STD. Well, guess what? We don't know. Unless we take the time to test, right?
Right.
To require that they test,
Mm-hmm.
go in together, or use a condom and take our chances. So all I'm saying is, as we talk about this conversation of empowerment in these days and times, empowerment means you're educated. Empowerment meant if you got a phone and that's all you have, take the time and find a science-based resource and stop listening to TikTok with some of these folks who got their medical degree from the streets.
Yeah.
So I have a question, Dr. Gaddis
Yes.
and Mrs. Bynum Dozier. And I don't know, Dr. G, I don't know how deep you can go into this, but are you familiar with Mark Robinson,
Yes.
the politician? You said something that made me think about. Tam, are you familiar with Mr. Mark Robinson?
No.
Okay. So for those who don't know, Mark Robinson is running for governor in the great state of North Carolina. He is someone.
Yes, I am. Yes, I
You're
am.
familiar with him. Okay, great. This is going to be
Yes,
great.
I am.
Yes, I am.
I know exactly where you're going with this.
Yeah. So he is someone who has rallied against trans rights. He has rallied against LGBTQ rights. He has basically said that if women would keep their skirts down, they would not need to get abortion, all sorts of things like that. Well, recently there was a report that came out that found from CNN that Mr. Robinson is someone who has frequented porn message boards, one called Nude Africa, and has admitted that he loved to watch trans porn. His wife had an abortion, I think 18 years ago. That came out. That was the first ball that dropped. And also he was has somebody who owns a porn shop said he used to come in with pizza and sit in the back room of the porn shop for hours at a time. So I asked that question. And well, I'm asking this question because I want to know, what role do you think politicians who aren't upfront and who aren't authentic in their approach to issues such as this are having on the fight to cure HIV and AIDS? Because these folks are living lives that are secret, and then they are voting against and rallying against things that are against what they are honestly for, what they are, for lack of a better term, in the closet doing. What role do you think our politics has in this battle and in this fight? Of course, we all know Roe v. Wade and all of those things, but when we talk about trans rights, when we talk about care for HIV and AIDS patients, when we talk about getting services for those that need it, what role do you think politics plays? And what could politicians do? Anybody can, either one of you.
I mean, Miss Dozier?
Go ahead.
He said, are you waiting on me?
Yeah, you got this one.
He doesn't,
You touched on this already.
Exactly. Part of it is that he's referring to the hypocrisy of it all.
Correct.
But here's the thing. The same thing happens in the pulpit.
Mm-hmm.
It's not just in politics.
And it's not talked about.
Exact thing in the pulpit. Anytime you have a religious leader who's calling, as they profess it to be, is to serve God's children, to be a shepherd. And they, in fact, have thoughts, behaviors that they condemn, but yet they manifest in their private life. I don't necessarily have a judgment about that. What I have a judgment about is more about how is it that we don't hold them accountable.
Mm-hmm.
What happens when persons like this man, who, because we all know once you go into politics, your life is open game.
Mm-hmm.
You're better able to hide those things maybe from a pulpit. But even when these things are come to the light, we don't hold folks accountable for the hypocrisy and the tyranny and the terror that they invoke on people as they live their lives of lies. Mm-hmm. And so we're going into now a place of voting.
Right.
And so if you want to ask me what is the solution, how do we address these things? I think it's an individual journey. When I had a clergy leader who I deeply admired, who my beliefs of come as you are,
Mhm.
meaning that all children are God's children, and God speaks very clearly to us about how we treat his children. And so when there were things that were said that I thought were not so much hypocrisy, but just condemning another human being and using their influence to do such a thing, I asked for an appointment. I went to meet with them. I shared with them my personal views. I shared with them the implications of what they were saying, because people were telling me while in church, they were inboxing me, asking me what I thought because of my work. What did I think about what was being said?
Mhm.
And for that reason, I went to them to speak to them, to let them know that there were people in their pews who were asking and questioning themselves and God because of things that we're saying. So as we move into this voting season, we are being called to stop the nonsense of allowing these same individuals to continue their tyranny
Mhm.
in their congregations, continue to tie to people that we know are terrorizing believers who want to find God but can't see God in them when they're standing bashing them from the pulpit and from their political seat.
Mm.
So let me just say this last point. I sat with a legislator I respect, and it was around the abortion conversation, the 6-week ban. And I asked them, what did your constituents say? Did you talk to your constituents about where they sit in this conversation? And he told me that he talked to his constituents, and his constituents did not believe in a 6-week abortion ban. They thought that it should be longer because most women don't even know they're pregnant until the 5th or 6th week, right? But yet, he told me that when they voted on the bill, that he voted party line. So in fact, it didn't matter what his constituents believed. It didn't matter what his constituents said. He voted party line. So I had a choice to say to him, I totally disrespect what you did. I totally feel this way or that way, but I chose not to take that space. I decided that he is a work in progress and that I should devote more of my time trying to deal with him. Why? If it was a clergy person, I might go in another direction. I can tell you what I would do. I would leave. But in a political space, these folks sit in office for years, for decades, and impact the lives of hundreds and thousands of people in my community. And I am obligated as a voting citizen, one, to vote them out if I can, to be part of that, to not allow my apathy or my disdain or me being totally pissed off about how they're acting, to take me away from the most important matter, that my vote matters.
Absolutely.
It may be one vote, but it matters. And that's what we have to do to address the issue that you bring to the fore, Dion, with people who are working consistently to attack and to bring other people down. We got to get them out of those seats.
Now, a lot of what you said, Dr. G, I want to shift gears just a little bit. A lot of what you said involves a level of trust, right? We trust our people when we vote for them. We see what's going on in New York right now with Eric Adams. He had the trust of the people of New York, and all of these things that go on. But I want to talk about trust in a different way. I want to talk about the trust that has to take place between someone who is living with HIV and the healthcare providers, because too often there is a level of mistrust between us in the Black community and the folks who, uh, we put in charge of our health. So,
Mhm.
Tam, talk to us a little bit about why it is important to have that level of trust and to build that level of trust as someone who either provides healthcare, provides services to Black women, to Black folks in general when it comes to HIV care.
It's very important because, like Dr. G said in the beginning, you lose a lot of people, especially since they don't trust anyone in the healthcare field. And sometimes, as we see it, with Black women in general, they're not listening to us when we go to the doctors.
Mm-hmm, mm-hmm, mm-hmm,
So being an advocate for them, and holding their hand and walking them through that process and going through it with them gives them the confidence and the empowerment to be able to stand up for themselves, to advocate for themselves at some point. But you give them you give them that level of comfortability to be vulnerable.
mm,
So
mm,
I take it, um it's my responsibility to help my clients feel confident in what they have going on, and then empower them to be their own advocate, because if they can't speak up for themselves, nobody will.
mm,
And there
So
are
I
skills that come with that.
Right,
So our job is to teach them that skill. Number
give them
one,
those tools
never go into an appointment without a notebook.
so that
Never,
you
never,
know. Mhm.
never get on the phone with anybody and don't ask them their name.
Correct.
You know who you talk to.
So
Say,
that
"Excuse
if you
me,
have to
what's your
reference
name?"
back. Right.
And jot their name down.
Mm-hmm.
Never go into go prepare before you go in your doctor's office. Write
Correct.
down some questions that you may have, and don't leave without an answer to those questions.
Mm-hmm.
mm-hmm,
So when
mm-hmm,
Miss Dozier talks about walking them through it, sometimes you literally, it's like a senior. Like
You're
sometimes
walking them
you
through
got to
it.
walk in there with them because,
Mm-hmm.
folks lying when you, my mama used to lie when she passed in 97. We had to go with her because she come out saying, oh, it was good. And the
Mm-hmm.
doctor said this, that, and the other. No, no, we going with you because
Mm-hmm.
things not all good.
Correct.
mm-hmm, mm-hmm, mm-hmm,
Or you have to do that because they don't understand what the doctor is telling them.
mm-hmm,
So
mm-hmm.
they don't understand the jargon of these medical terms and the effects of things and the symptoms, and they don't get it. So you have to go with them to break it down in layman's terms. Talk to them, meet them where they are versus where we are as professionals.
Mm-hmm. Dr. G, was it here where someone said that they went into a doctor's appointment and they were on the clinical side and the doctors were explaining to this patient what was going on, and it was a male patient and the male patient just was kind of like whatever, and then the person who was on the clinical side went in and was like, okay, I know you didn't understand what they were saying, but this is what it was. Boom, boom, boom. I can't remember if that was someone that we spoke to or somewhere else that I saw that. But I want to speak to, because you both made me think about something. My wife oftentimes talks about bedside manner when she goes to see her physicians. That's something that I've never had to consider. That's something that probably it's a point of privilege to a degree for me because I'm a man. I just don't really care all of that. But it's been several times that I've been to the doctor with her, and she's pointed out, or we've had a conversation about someone's bedside manner. Now, Tam, I want you to speak not from a social worker standpoint, but just as a Black woman. What role does empathy play in what you experience and how you experience your medical treatment?
A big role. I can speak to several experiences where the medical professional lacked bedside manner for me.
Mm-hmm,
in serious instances, and not to, get too oversharing, but sometimes I do have to leave out the fact that I am a social worker and I
Mm,
know how bedside manner is supposed to look in this
mm-hmm,
instance to see if I'm going to get the care that I deserve. But it's very important because it also helps that patient, that client, to feel vulnerable, to feel empowered, to take on that information that they're giving you in that instance, so that okay, my next steps is this and this. I can do this. But if they don't care when they're giving it to me, then how am I supposed to care or really understand what's happening?
mm.
Well,
Okay,
oh, I'm
you
sorry.
got it, Dr. G. No, no, go ahead, go ahead.
Go ahead, Dr. G.
I was going to say I'm probably the opposite.
Okay.
I can see that.
I want them. I don't play myself down. I don't minimize, and I'm not saying you do. I'm just making a point.
Mm-hmm.
I don't want them to think they can tell me anything. When I walk in that space, they know I'm not that chick. And I want them to know I'm not that chick. I tell them how I ended up in their presence. How did I end up in your presence? Is because I picked you. I picked you.
Mm-hmm.
And I picked you because I know you do this, that, and the other. Because I read up on every single physician
Correct.
So,
that
Dr. G,
touch.
hold on one second. I want you, because you're getting in something, and I want to call out what that is. So, what you're saying is that you are able to advocate for
For yourself.
yourself,
Yes.
right? So, but hold on, Dr. G, hold on. I want you to tell the person who is watching this, who does not have I'll call it the gumption, because you got a lot of gumption over there, who does not have that, how they can go in that space and get the gall to do what you do to advocate for themselves. Start
I've
from the
already
beginning.
started. I already gave you some intro into that. Number one, it is making sure that you know who you're talking to at all times.
Mm-hmm.
Make sure you document who you're talking to and what they said to you. Even you do it after you leave. You write down notes of how you felt when you left out. I felt good. I felt empowered. I felt respected. Just because you'll forget. Then the other part to that is, Ms. Dozier spoke to it. You seek support from people who you know have your back. And if you need them to go with you, you ask them to do that. Another thing so to that person, part of what they struggle with is the diagnosis itself. We're still working through that. I mean, that's not something that just manifests. They're dealing with what they're going to tell their family, what they're going to tell their lovers, who they're going to tell. Sometimes they can't tell anybody right now.
Sometimes they never tell anyone.
But sometimes they never tell. So the relationship for that person who's at the very beginning stages, or I've known Black women who've carried this for years and haven't said a word.
Mm-hmm.
Okay, but what every single one of us should be about is, one, stay away from people who don't empower us.
Mm-hmm.
I don't care who it is. Stay away from people who judge you. Look for people who support you and understand. Go to support groups. If there is a HIV positive support group for women at the organization, and if it's not at the organization that does your medical care, don't get caught up like church, where you can only go to one church. You can go to get your medical care in one place. You can go get your social support somewhere else. You can get your housing from another provider. You shop around.
Mm-hmm.
Shop around and get your medical case manager, someone like Ms. Dozier, who gives a crap about about her clients, because you got some of them who don't care too now, Mr. Chavis. You have some folks that are in here strictly for the job.
Just for the job.
And I would say to them, if you have a medical case manager and they're not treating you well, you have to speak up.
Mm-hmm.
You must speak up, because if they're doing it to you, they're doing it to others. and you have the right to be treated well. If it's a physician, and I'm making some good
Exactly.
assumptions here about what happens when you live in a small rural town and you only have one organization
To
and
choose
that's the
from.
only people providing care. It's a little more tenuous. And folks are quick to try to say the people living with HIV and people that have other health disparities, they always want to brand you. They want to say, oh, they're angry Black woman. No, she's asking that you respect her and you give her the social support and the care that
That
she
she
deserves.
deserves. Mm-hmm. Yep.
And
So
so
what
it's step by step.
so what I've noticed, Dr. G and Tamara, since the pandemic, right? And this is speaking from personal experiences and things that I've noticed. Since the pandemic, and I believe I've said this on the show before, the medical field has been lacking. It is harder to get quality treatment for yourself, for your loved ones. People will, say that they're going to put you in touch with this specialist and they don't do it. People will say that, this needs to be done and you got to go to it. It is extremely hard to find. I'm not saying it's hard to find a good doctor. I'm saying from what I've seen and what I've experienced since COVID is that once it goes beyond just like going to the doctor, whether it be getting testing, whether it be, oh, you need an MRI and you got to go here, or your insurance says, oh, you don't need to get an MRI. You just need to go home and take some migraine med. You know what I mean? All of those things. It is extremely hard to push through. So what I would say is that for anyone who is, because it can be, it can make you want to give up, honestly, right? It can make you want to give up jumping through all of the hoops. Just stay persistent. And I'm not saying, and this is just far beyond HIV and AIDS. This is just for your personal health, right? It could be a colonoscopy that you need. It could be you need a test on your gallbladder, whatever the case may be. It seems like you're going to have to jump through a million hoops, but you have to stay persistent and you have to continue to push to advocate for yourself and get the services that you need.
Mm-hmm.
So we're at time. This has been a wonderful conversation. I enjoyed both of you. Thank you, Black women, for educating me and making me a much better person after this conversation. Dr. Bambi Gaddis, happy 69th birthday again. You look fabulous. I told you, you look like you smell good. Got your shoulders all out. Where's your husband? Go get your husband. Y'all go enjoy. Where Bernard at?
He left this room to go inside because I said I have a webinar with Mr. Travis and Ms. Dozier.
Okay.
So I'll see him.
Make sure he take you out on the town after that fashion show. Y'all go.
I've already been on the town.
Oh, you already been in the town. Okay, excuse me. Well, pardon me. Do you have anything you'd like to say to close us out, ma'am?
No, I was just going to tell you that was a great closing statement.
It was.
Thank you so much.
It was a great closing statement about taking action and being persistent. And so all I have to say is please vote.
Please vote.
We need every single vote.
For sure. Sam, give us the information on masks before we get out of here, because I know Keisha's watching and she's going to want you to give us some phone numbers, some websites, or something for people to get in contact with your organization.
Hey, Miss Keisha.
Yes, you can definitely hold on. Let me because I knew you was going to do that.
Mm-hmm.
You can reach us online, www.minorityaidsupportservices.org.
All right. Thank you all so much. I appreciate it. We will see you all next month. We already got next month's show lined up. We couldn't get it in for this. Keisha said, hey, Dr. G, we couldn't get another show in for this month, but next month's show is going to be really, really dope as well. Questions, comments, concerns, be sure to hit us, any of us up on social media. We're all on Facebook, so be sure to find us there, and we will holler at y'all on the next episode. Peace.
Thank you. Have a good night.
Good night.